For 8 straight weeks now, jobless claims have been in the millions, with 3 million more people filing for unemployment last week. 36.5 million Americans are now out of work and filing claims since mid-March. And while the weekly numbers are improving, we still don't know how long it will take for the U.S. economy to fully recover. NBC News senior business correspondent Steph Ruhle joins me now. And Steph, before we talk about the bigger picture here, let's get into this jobless claims report. It is terrible, no doubt, but economists are saying there are some good signs in it. What are they?
Okay, so we always have to remember we turned our economy off, right? So people are going, this is unprecedented. We've never seen anything like this. How do you compare it historically? You can't, Allison. Remember, this did not happen naturally. All of these companies didn't just go out of business because demand disappeared. We turned our economy off. Right? Think about New York. Think about the state of California. If you ran a restaurant, a mini golf course, or a clothing store, even if it was a hat store, there's a really good chance you would have laid your workers off. Why? Because unemployment benefits today are more generous through the CARES Act than they've ever been in history. So yes, it's bad news when you see all of these people on unemployment in the bigger picture, because when you fall down this far, this fast, you're not going to just snap right back. Businesses aren't just going to hire all of those people right back, in part because even if they reopen, most businesses are reopening to a limited capacity and they're not going to need that many employees. So that's the bigger issue. When this thing rolls off in August, how many of those people are going to get jobs again?
I mean, Steph, you keep saying it's unprecedented. I think we all agree, but we keep hearing comparisons to the Great Recession, the Great Depression. Can you even make those comparisons? Is this situation just completely different?
No, it's ridiculous to even try to make that comparison. This is totally different. Remember, then there was economic disaster. People didn't have the money to spend. And now there were healthy businesses that had to shut down and they laid their workers off and they're currently not open. Right. So this is totally different. My issue is that come August, when this rolls off, remember, during this period, all of those people on unemployment, listen, they wish they were at work. The dignity of work is obviously much better than not working, but they're making more in unemployment benefits than it's ever been offered before. So hopefully they're making it through so they can support themselves and support their families. The bigger issue, when we get through this, when this period of enhanced unemployment rolls off and we reopen America, how many jobs will be available again? To me, that's the bigger issue.
Yeah, Steph, let's talk about that. I mean, 1 in 5 Americans who had a job in March, unemployed right now. Economists are saying the longer that this goes on, the less likely we'll get that V-shaped recovery or a snap back to normal. So what do we need to do to bring workers back? And what's a more realistic expectation of what this recovery might actually look like?
Listen, you know, the idea that it's going to be a V-shape, no. Obviously, we are enthusiastic to get back out there. We'd like to go out to eat. We'd like to go to the gym. But realistically, when you look at businesses, think about the airline industry. Just yesterday, the CEO of Boeing told our colleague, Savannah Guthrie, he thinks one of the large airlines could go down, could go under come this fall, right? They're expecting that maybe they'll be at 25% capacity come the fall. You can't be a profitable airlines if that's your situation. And think about this. Let's say we all go back to work. All the businesses that are now comfortable with people working from home. Now that Twitter has said all their employees can work from home indefinitely, what do you think that is going to do to all the local businesses that are around Twitter's headquarters? What is the best way that hotels and airlines make money? Business travel. Do you think when this is all said and done, corporate America out there is going to say, great, let's head to all those conferences. Let's have people spending, paying full rates in hotels and business class flights. Don't expect that anytime soon. So this idea of a V-shaped recovery, I would prepare yourself more for like the Nike swoosh.
That is a much better description, Steph. I like that. I think it's a little bit more realistic. Thank you so much, Steph. Great to have you with us.
Thank you.
Dr. Rick Bright ran the federal agency overseeing vaccine efforts until he was reassigned last month. Today, he told Congress the window is closing to fight the coronavirus pandemic.
The virus is here. It's everywhere. We need to be able to find it, isolate it, and stop it.
Internal medicine physician and NBC News medical contributor Dr. Lippy Roy joins me now. And Dr. Roy, what were the biggest headlines for you from today's testimony?
Yeah, talk about a nerve-wracking experience, sitting there in front of all of those members of Congress. Gosh. But I have a lot of respect for Dr. Bright. This is a man who really knows his science, and the impression I got was that he was genuinely concerned about the livelihood of the American public. He kept emphasizing the science and how the science needs to take precedence over anything else, including any type of political agenda, business or corporate agenda. The safety of the American people was paramount, and that was the impression to me that came through.
Dr. Roy, Dr. Bright said that there is no federal master plan to protect Americans' lives and that this virus is spreading. How concerning is that to you, given that some states are starting to reopen right now?
Allison, that's very concerning, especially when you consider that we have known about this virus really since last December back in China, and it's been in the United States since January. This is the richest country in the world. We have the resources. We have the wherewithal to get the appropriate equipment, protective equipment, reagents. We have all of the resources, really. But I felt that we were slow in the beginning, according to the experts. But right now, let's respond now and do what's necessary now by using public health measures that are evidence-based to keep people safe.
Dr. Bright says if the government doesn't get a plan together, that we could be in for the darkest winter in modern history. In your view, what do we need to do to best prepare ourselves for a second wave of the coronavirus as we head into the fall?
Yeah, that's a great question about the second wave, but let's be clear. We're still actively in this first wave. There's variation state to state, but some of the measures that public health professionals have been stating time and time again is that, look, we can still reopen some businesses provided we have public health measures in place, such as widespread testing side by side with contact tracing and identifying positive cases, isolating them, contacting their contacts. If people wear masks and are able to maintain that physical distance, then it might be okay to slowly reopen certain businesses and companies. But we cannot take our foot off the brake when it comes to these preventive health measures.
Dr. Bright has talked about the timeline for a vaccine. Here's what he said.
Normally it takes up to 10 years to make a vaccine. We've done it faster in emergency situations, but for a novel virus, it's actually haven't been done yet that quickly. So a lot of optimism is swirling around a 12 to 18 month time frame. If everything goes perfectly, we've never seen everything go perfectly.
He also had safety concerns about this sped up timeline. What are some of the concerns here? And can we get back to any sort of real normal without having a vaccine in place?
Yeah. Most of the time, Allison, I'm somebody who's very, very optimistic, but it's important that my optimism be grounded in data. So the reality is that I think if you look back in history, the fastest we've had a vaccine produced was maybe 4 to 5 years. Suppose we get a vaccine in 1 to 2 years. The thing is that there's no guarantee that this vaccine will even be effective or work. Dr. Fauci said that during his Senate hearing, and I'm quite certain Dr. Bright has said that in the past. So we have to bear that in mind. That doesn't mean that life stops, though, for us. That means that we have a new normal. It means that we have to really continue practicing good hand hygiene, physical distancing. We have to really implement public health measures, but that requires federal funding of public health departments, which have been cut back drastically over the past decades.
Dr. Roy, a virologist and contributor here at NBC News, our good friend Dr. Joseph Fair is in the hospital right now with the coronavirus. First, we'd like to send our prayers and thoughts to him for speedy recovery. He thinks he got this, though, on a flight through his eyes. Here's what he said.
We tend to focus on the nose and mouth because that is the most common route. But, you know, droplets landing on your eyes are just as infectious. And, of course, I wasn't wearing goggles on the flight.
Dr. Roy, we've talked so much more about the mouth and the nose. What can you tell us about potentially getting the coronavirus through your eyes?
Yeah, so I'm so glad you aired that clip about Dr. Fair. Can I just share with the public who may not know this? When I started at MSNBC in mid-March, I used to see Dr. Fair almost every single day back in the studio when they still allowed people to come into the studio. And I can tell you, he practiced such good precautions in terms of covering surfaces, washing hands. And for an otherwise young, healthy individual to contract the virus, it just goes to show that any one of us can get it. So, yeah, Joseph made a point about the eyes. So he's right that there can be transmission from the eyes. I actually just texted him, and he's been downgraded from critical to stable status. I'm really happy about that. But the truth is that we don't really... we at the end of the day don't know exactly how he got it, and he admits the same. He's speculating it was the eyes, but remember, the mask, it provides some protection, but not the true protection is the distance. And remember, he said that he was packed in like sardines on the airplane. So, I mean, he also could have contracted in New York. It's hard to say. The point is, please, all precautions. Don't go out unless you have to, and maintain that distance. Cover your face as best you can, nose and mouth, and if you can, your eyes. But the most is through the respiratory droplets.
Thank you, Dr. Roy, so much for all of your advice and expertise, and also for the great news about Dr. Fair. We are, of course, all wishing him well and hope that he is back home and healthy soon. Thank you.
Thanks, Allison. Bye.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.